It may seem early, but now is the time to start thinking about your healthcare coverage for 2023. So, what can you expect to see from providers in the new year? Well, today we're getting that answer thanks to Mike Berteau. He is a healthcare economist and the author of the Straight Talk blog. Welcome back to the show, Mike.
Thanks so much for having me, Malik. It's a pleasure to be with you today.
It's a pleasure to be with you as well. And look, I can't believe it because, Mike, we still have a couple of months left in 2022, but we really need to start thinking about 2023 healthcare coverage. Why is now the time we should start thinking about that?
Well, things are moving along pretty quickly. Beginning on October 1st, people who are 65 and older, you'll see health insurance plans starting to talk about their Medicare offerings. You'll see TV commercials and online ads and a lot of things kicking off on October 1st. On October 15th, an annual open enrollment period will start where people can pick and change plans, and that'll run until December 7th. And all of the new coverage seniors will pick during that period will kick in on 1/1 of 23. So time's moving forward very quickly. If you're not a senior, you're not on Medicare, you'll find that your employer will be much more likely to start his open enrollment process in the fall over the next couple months.
And that's what's so interesting because, many of us have to reapply for healthcare insurance every single year. So let's talk about what we should be looking for in a plan. What do you suggest?
It's critical, and I tell everyone this, family members, anybody I'm advising, when you're looking for a health plan, be sure to check to make sure the network of covered providers includes your doctors that you use already and the hospitals that you're more likely to go to and all of the prescription drugs that you're already on, because you don't want to have new insurance at a great big disruption. Ideally, what we'd like is for your care to be continuous and not have any gaps and not have any problems. So look for the provider, look for the hospital, look for the prescription drugs, and make sure the plan you pick covers all of the things you need.
And maybe you had a baby in 2022, so you have to start thinking about that. Or maybe you got married in 2022. I'm jealous. All those things need to go into the conversation as well. But I want to focus now on our seniors, right? Medicare, maybe for some people, this might be their first year in 2023. It can be confusing because there are so many different aspects to Medicare. But luckily, you all have this Medicare Made Easy Facebook Live situation that you all do. You all actually have one coming up at the end of August. What can you tell us about that?
Well, with Medicare, there are A's and B's and C's and Plan D, and it can just get really confusing. I get a lot of phone calls because now I'm over 60. I get a lot of phone calls from people who are about to go into Medicare, and the confusion is out there. So what we really want to do at Blue Cross is to host a series of virtual educational events where we can put experts online. We call them Medicare Made Easy. We want to talk to you in plain English, answer people's questions, and we do it through Facebook on Blue Cross of Blue Shield of Louisiana's Facebook page. It makes it very easy to watch. If you miss one, we archive it and put it on our YouTube channel at BCBSLA. So there are plenty of chances to watch and learn before you have to make a really big decision.
And what age is that Medicare eligibility starts? 65, or has it gone lower?
Well, for the average person, 65 is the norm. You'll get 3 months before your 65th birthday, plus the month of your 65th birthday, plus the 3 months after your 65th birthday to make a decision on your very first Medicare choice.
Wow. Well, if it's your 65th birthday, happy Medicare time for you, And for people who are not necessarily eligible for Medicare yet, they're just going through the regular enrollment process for healthcare. What's one thing we need to make sure we look out for when enrolling?
Well, always be in touch with the human resources department at your company. They are typically the ones that manage all of your benefits, including your health insurance benefits. If your employer doesn't offer coverage, you have a great position right now where you can go to healthcare.gov and enroll in individual coverage, often with generous federal assistance, which I highly recommend. And at the same time, the people on healthcare.gov will screen you and your dependents to see if they're eligible for Medicaid. And if they are, they'll make a referral for you. Congress just extended the very generous subsidies under the ACA just a short time ago. And so we'll have this favorable tax credit situation for the next 3 or 4 years in a row.
Some great options available, whether you are over 65 or under 65. Thank you, Mike, for joining us this morning. And look, everybody, for more information about the available healthcare options for 2023, it'll be here before you know it. Log on to straighttalkla.com or bcbsla.com/Medicare. You can also give them a call at 1-800-568-1417. And of course, follow them on social media at BCBSLA. Now, stay right there, everybody. We'll be right back.